Hello, I'm Nancy. I'm one of the nurses in the clinic. I'm the clinical section, not in the research section. And thank you all for coming today, those of you that did manage to come on out. I wanted to say that I learned a lot by getting ready for this presentation because I interviewed every department in the building and asked them for what they thought would be most helpful for patients to know to get the most out of their experience here. So this is going to be very informal. If you want to move closer, you may. If not, just stay where you're comfortable. And you can interrupt me at any time. There's nothing, that structured here. I put together this handout because if you forget everything I say, that's okay because it's pretty much all here in the handout. All right, you can scribble notes on it and do whatever you think might help you. I wanted to first preface by, the clinic keeps growing and growing and growing. I've been here since January, and I know they started with one medical assistant back in like 2011, was it? Or 2013 is when I see most of the appointments. But we've come a long way, and we now in the clinical section have a complete staff of 5 RNs working there in one section and another one down the hall. So there's a lot of us, as well as all the nurses up above in research, and we have lots of medical assistants and other support staff on board. And part of that has led to what I call growing pains, and lots of the concerns that the nurses are dealing with every day are patients having a hard time navigating the system. They're having a hard time knowing how to reach the nurses. So I put this together hoping that this would simplify the process a little bit. I did put a key at the top, so does everybody have the handout? There are handouts on the chairs if you didn't get one, make sure. So if you didn't understand some of the abbreviations that we're using, they're acronyms for different terms we use commonly that might help you. You're all here already, so if you're a brand new patient or you're coming for a new service here, we say allow plenty of time to get here. If you've never been to the section before, you might make a dry run to just check, well, where is that going to happen? And I like to remind people that Rachel's Kitchen right outside does sell refreshments, so if you are waiting for any length of time, you're welcome to, purchase something and sit out in the pretty courtyard and have a nibble. We do not have any vending machines in the building, and you've probably stumbled into that already. So we can give you water and mints, and that's about it. Otherwise, you'll need to catch Rachel's. Now, one of the things, I've talked to our check-in personnel. We call those PSRs. So if you hear the term PSR, have you all heard that? Somebody said, ask the PSRs. Okay. That's our patient services representatives. And we also call them our schedulers. They're the people that answer the phones. One of the things, they had lots to share to try and make things smoother for everyone. And they recommend that you make sure that you're here at least a half an hour before your appointment time. So when you make an appointment, be sure what is the time with the provider, that's the appointment, but you should be here a minimum of a half hour ahead. And why is that? Because if you've already had an appointment, you know that the medical assistants meet with you to take your vital signs, and after they take your blood pressure, they ask you about your medications, any medical history questions. And then you may require some cognitive assessment, different kinds of testing, and all that has to be done in the half hour before your provider. Now, if you're moving slowly, you want to allow even more time because you are going to have to get up to the second floor and navigate about the building from the scale to your room, etc. And we want to make sure that that gives you time to get everything in before the provider meets with you. Make sure also that you have your insurance card and your photo ID. And one of the things that they asked me to tell you in imaging is if you have a product card from any implants you've had, let's say you've had corneal or lens implants, or you've had an implant on any part of your body that something's been implanted. They give you a product card at the time of your surgery. it's really smart to get that scanned into our system right away and not wait till you need a procedure, because people often lose those, and 2 years later when they decide you need a CAT scan or an MRI, if you can't find the card, it's going to really slow things down and maybe make it impossible for you to even have the procedure. So they recommended that at your next appointment, even if you don't have a scheduled imaging appointment, just bring the product card. We'll get it scanned into your chart. You should be putting that original in a safe place, like a safety deposit box, and making copies that you can be carrying about with you. But get that on your chart as soon as possible. If we never need to use it, that's okay. But if we do, it's going to make things much smoother. Also, if you have any paperwork regarding being a power of attorney for someone, whether it's for healthcare or for financial, just get that power of attorney into the chart right away. When you're asked for your insurance cards, don't forget to provide your prescription card. That's been a big problem because we spend a lot of time trying to help with low-cost options and getting prior authorizations for medication. And if we only have the insurance card, that's a separate card from the prescription one in most cases. The prescription card is something we're going to need to chase you for it, and that too will slow your prescription down. Just have them scan it to the chart when you check in or when you check out, and we'll have it on file already. All of you should have a 3-ring binder that you got when you started as a patient here in our facility. Most of the departments request that you bring that with you, the 3-ring binder, and then you can keep everything together. I'd recommend that you put this in your 3-ring binder because it's got lots of resources for you. Also, when you're checking in or checking out, you're going to see lots of places that I put a space where you can get a passcode for using MyChart. How many of you are using MyChart already? Anybody in here use MyChart yet? Okay, all the providers are using MyChart. And while I'm thinking, I'm going to stop and introduce some of the other providers for just a minute so you know who these people answering all of your MyCharts and phone calls that get routed to us are. We've got Linda. Linda, if you'd raise your hand. Linda is the multiple sclerosis nurse. So if you have MS, she's the person that you're probably going to be talking to, unless it's Geraldine, who isn't in here at the moment. We also have Claire, and she's also on the brain health team with me. So for pretty much most of the dementias, we're the ones who answer the phone calls. And if you're a person with a movement disorder, we have a nurse, Jeremiah. He's the only male nurse on the clinical floor, on floor 2. And we also have Regina, who's probably up there celebrating her birthday a day early, huh? She didn't come down either. All right, but we're all around. And I'm sorry, in that front row I forgot to mention is Marsha, who is who's our boss. She's the head of all of us. So if you have an issue that goes above us, she's the one that gets it. All right. Now, but that's the clinical staff who's in the room at the moment immediately. At this point, does anybody have any questions? And I was going to say, we're going to talk a little more about MyChart, but I could digress to that now. If you're not a computer savvy person, you probably don't want to use MyChart, but I will tell you it's pretty easy to navigate. So if you're able to send an email normally, it should be very easy for you to use MyChart. It's kind of just a medical version of an email. You're just going to type a message. Some of my patients, I ask them if they don't want to use MyChart because they don't like typing a lot. I don't really like typing a lot either, so I understand that. I say, just send me a MyChart that says, please call me, and then I will call them. Because sometimes it's hard to get through the phone tree. So you can always, learn enough on MyChart to route a message to your provider to have somebody call you, and you don't have to explain all the details. Some people love to type out all their issues and concerns and want all that typed response back. That's fine too, and it's a very useful tool if that's something that works for you. All right, now there is a form you get when you check in called an authorization to disclose health information, And when you come to your appointment, just make sure that yours has been updated, because sometimes we'll get a phone call and it's from a son or a spouse, but they're not on the authorization. We can't talk to them. And all we can say is, we're sorry, we can't give you any information. So make sure that if you're someone who wants to receive information, your name is on that disclosure form. Also, make sure that the name of your physicians are on that. There is a place that we put who your PCP or primary care provider, that's your main doctor. If you're not sure what a PCP is, your general doctor who coordinates all the other doctors is your PCP. And that person, we really need their phone number and their fax number. There's lots of times we fax information and we have to do a lot of research to find out. And if we know that that's up to date and you brought even just their business card from your appointment with them, that would be very helpful to get into your chart. Okay, once you arrive, how many of you already have come in for an appointment? I assume most of you, but am I assuming incorrectly? Has everybody who's here come for an appointment yet? You haven't come to an appointment yet? Okay. All right. When you do come, all right, what's going to happen is you're going to be greeted by our volunteers in the main lobby, and then they're going to tell you to go to the check-in desk on the first floor, which, by the way, is right next to our beautiful library. If you haven't been in the library yet, I'd recommend you walk over there after this presentation because they're open. Jasmine, do you know what? We expanded the hours, I think, since I put this together. It's 8:30 to 4:30 now. Okay, so your handout says 10 to 2, but I know they just very recently expanded the hours, and I don't think we got the updated hours into the handout yet. But just wander over, and Dr. Ritter, one of our neurologists, has told me he thinks we have one of the best collections of brain health information in the country in that library. And we not only have hard copies, but we have electronic versions. So if you sign up, you can sign out an ebook, meaning that you can be at home on your computer reading the book, and you can take your time and just do it in your own comfort. So if you don't want to sign out a hard copy of a book, just check the ebook collection too. Now, as I said, once you arrive, you'll be greeted by one of our volunteers in the lobby, and then after you've been to the check-in desk, you're going to be taken to the second floor, and what we do is we call it rooming. Once you arrive on the second floor, someone will just offer you a seat. Just inside the door there are bathrooms. You're welcome to just go through that door and use the bathroom if you need to. Very often the medical assistants are seated, but they don't respond to you. And I know patients have been concerned that no one says anything to them, that you're just seated there and you're waiting. Someone will call for you, but don't think they don't know you're there, because that volunteer brings up a little card and puts it in a slot, which tells them you're next. So they are aware you're there. Sometimes they're on a phone call trying to get one of these prior authorizations to help you or something like that, and they won't stop what they're in the middle of to acknowledge that you arrived. So they did want you to know that they know you're there, and they will get to you as soon as possible. And when you're roomed, they're going to basically weigh you and then take you to the room where we already talked about they're going to take your blood pressure and your medical history. And then you may have some testing afterward, depending on which provider you're with. But again, help yourself if you need the bathroom. You don't have to interrupt anyone. Make sure that you're bringing a list of your medications and your supplements. That includes herbal supplements. And you want to include the name, dosage, and total times a day. They said don't put down that you take it in the morning and at noon and at night. Just say I take it 3 times a day. That's what they need to know. And only current medications. We don't need to know medicines you were on last year or things you aren't using. We request that you verify with your pharmacy that your list is accurate. Sometimes they'll print out that list for you. And we always say that superstars alphabetize the list. But if you don't want to bring the list, it's okay to put all those medications in a bag and bring them with you. And then they'll look at the bottles themselves. Don't bring a pill organizer, however. Those are the ones where you put like 1 day's dose in each little snap section. because they can't look and say, oh, that white pill must be, they can't do that. So it's going to be much better if it's in a prescription bottle, or if you even just bring the empty bottles once you put them into your pill organizer, and they'll know what you're taking. Also, if you have a long list of surgeries, please bring the dates and the places. We will be requesting copies of imaging that you've had. So in Brain Health, we do lots of MRIs, CAT scans, and PET scans. So if you've had those previously, it helps us if we know where we're calling to get that information. So, or where we're faxing, just bring the list of the places and the dates. That will help a lot. And if you want to speak to one of the providers alone, if you're a caregiver and you want to speak alone, not in the presence of your loved one that has the appointment, please just slip them a little note, slip it to the MA while they're doing that rooming, and say, I would like to speak to the doctor or the nurse practitioner alone. It can be just a quick little, one sentence thing. Let them know. You can also let someone know at check-in, and we'll try and arrange that moment or two of privacy with the provider for you. When we get to the provider section, I know on the same note, some of the providers have said if you have a specific concern and you don't want to say it in front of your loved one, you can just say on a notepad, patient has become irritable, or patient is now very demanding, or something, a little one sentence. They don't have time to read, a page there. But give them a quick little one sentence, and then they'll bring it up casually in the meeting and say, and how have you been feeling? Have you noticed a difference in your mood? Rather than you being the one to point it out in the visit, the provider can address it for you. Okay, does anyone have any questions? You're all listening so intently. I don't know if you're falling asleep or just following along. All right, everybody's okay with me so far? Wonderful. All right, now when you are with the provider, and I was really thrilled to see that the providers gave me so much input here as to what would make your visit a better visit. They really want to use all the time you have coming to you to your best advantage. I'm looking for providers in the room. I only see Susan Morgan at the moment. Am I missing somebody else? Okay. Susan is one of our physician's assistants. And if you get confused, physician's assistants and nurse practitioners are pretty much the same. She might differ, but if you're not seeing the actual MD, you're probably going to be seeing a nurse practitioner or a physician's assistant. And they are both very knowledgeable providers that have lots of years of education. After a bachelor's degree, they go on to more years of education, and some go through a medical school route and become physician's assistants, and some go through a nursing route for more years of nursing training and become a nurse practitioner. But they're both, very well-trained people that can do a lot of good for you. All right. Now, they do recommend that the patient comes with someone who knows them well. So don't just, if you're the person who drives them here, don't just drop them off and leave. Because especially someone with memory problems, they probably can't answer the questions correctly. So if someone who knows the patient is there at the visit, that's extremely helpful. Also, if it's your first visit, you want to bring like a written timeline of mom stopped driving in 2012, and she stopped walking in 2013 and became incontinent in 2014. It gives them an idea of what's going on in terms of the progression of the disease process. So that's a very helpful thing to just have a written timeline for the provider. Now, another thing one of the providers said to me is, please have your little conference about who in your family had what illness when before you come into the visit, so that you don't all have to scratch your head and say, I think Aunt Sue had dementia and I think Uncle John had a stroke, that you're not all trying to decide during the visit if you've collected all that data relative to the brain health in the family before you come into the visit. You also want to bring copies of your medical records, but only those related to your condition. So if you're here for brain health, we don't need copies of your knee surgery report, okay? So stop and think about, is this related to why you're coming? Also, if you have recent lab work, bring copies of the lab work, because the first thing a provider is going to order is more lab work, and it's crazy to duplicate what you just had done. And if you have questions, write them down in advance. I had to laugh. A couple of weeks ago, one of my favorite patients called me up, and I said, "Hey, how you doing?" And he goes, "Well," we chatted for a minute, and he brought me, and then he said, "But I don't remember why I called you." So I said, "That's okay. When you remember, call me back." So if you write it down, that won't happen to you at the visit. You'll remember what it was. I hate that. I'm always going home going, I should have asked this, or I didn't think to ask that. And if you write it as you're thinking about it in advance, that probably won't happen to you. You also want to bring any CDs of imaging. Please do not bring in your x-ray. Don't bring in that great, film that they hand you sometimes. We can't do anything with those. There's no way we can store them to our system, but nowadays they almost always will give you a CD of your imaging. So bring that little disc. We can copy that and give you back your original. All right, so that's extremely helpful if you have any imaging CDs. And again, we really only want things related to the brain or the spinal cord. When you do have a visit, if it's a return visit, try to have all of those referrals that were made on the first visit completed. Sometimes providers get very frustrated here because maybe on your first visit, well, put it this way, I work for Dr. Leger, and on the first visit, most of the time he's going to order a sleep study if you haven't had one, some lab work, and maybe an MRI of your brain. That seems to be a pretty consistent pattern. If you come back and you haven't done any of those things, he's just going to stare and look at you like, well, I think we need a sleep study, some blood work, and a brain scan. So you've kind of wasted both of your time because there's nothing to discuss, there's no results there. So if they do refer you for something, try very hard to have it complete before you return. And if that isn't happening, you can always call the schedulers and maybe have your appointment moved up a little bit. All right. Now, one of the things that the providers get asked a lot here is, I want to be in a clinical trial. How do I do that? People ask them. And they wanted you to know that some of the clinical trials are for treatment and some are just for observation. They're just tracking you or watching the changes that are happening in your life. Others, they may try a new medication. But you have to already be diagnosed with something, and you have to be stable on your medications. So if it's your first appointment, that's not the time they're going to send you to be in a clinical trial. They want to make sure that everything is stable and we do know what condition is actually one of your dementias. There's a book that I checked out of our library here that I'm absolutely loving. It was I don't remember the title, unfortunately, to tell you, but it's one of the award-winning books by a social worker about dementia. And she talks in there about 86 kinds of dementia. My jaw dropped when I read that. We see many kinds of dementia here. Everyone thinks that everyone who comes here has Alzheimer's. That's not true at all. There are many other kinds of dementia that we see and treat here. And you have to be diagnosed with one of those before we can even think about which study would be appropriate for you. Question?
Do doctors recommend clinical trials for certain patients as they get to know them? And
great question. If they think you're a good candidate for one they know is going on, they will bring it up at the visit. They'll say, we have this trial, because while doctors like Dr. Leger are clinical providers, on the days he's not with patients in the clinic, very often he's up working with the research people. So all of our clinical doctors also have their fingers in the research pot pretty much. And they know which studies are going on and who would be a good candidate. And they send out to the staff periodically, if you know someone who's got these kind of scores on their testing and this age group and this diagnosis, please refer them to us. So if we see that, we will, but you can also bring it up. And You can also go to option 7 on the phone tree that we'll be coming up on in just a moment, and that's the research division. They'll know exactly what studies are going on, and they can screen you right there and then and say, yes, you would be a candidate for this, or no, you wouldn't be. All right, I think we now have 26 research studies on the 4th floor. I think that's the latest statistic I heard. We now have 26 either starting or in progress, but there's 26, $4 million worth of clinical research up there on the 4th floor. A lot. So, and then also at the end of your visit, you should be receiving what we call an AVS. So if you hear us saying your AVS, where's your, that we're talking about the after visit summary. And that will summarize everything that happened in the visit, including all the medications you're on and any recommendations the provider made that maybe you need to, contact the social worker, maybe you need to get the sleep study. Whatever was recommended will be on the after visit summary. And if you're a caregiver who misses an appointment and needs just contact one of the nursing staff. We can get you a copy of that. If for some reason you didn't get it or the patient lost the copy or something, we can get you another copy. Does anyone have any questions otherwise at this point? I'm going to keep going then. All right. When it comes time to check out, make sure you look over that after visit summary. Sometimes somebody will say, well, the doctor said I should get this, but it's not there. It's okay to speak up, and one of the ladies, one of our PSRs at checkout, will call for a nurse. We run down all the time to say, oh yes, they were supposed to start a new medication and it's not there. Or or something's not clear to you. Are you supposed to take that once a day or twice a day? What's going on? If you don't think the AVS kind of summarizes what the provider said to you, call for one of us at checkout and we'll come down and clear it up for you. You should also express preferences for providers. Maybe the doctor said, I want you to go have a sleep study, and you don't want to go to Desert Sleep. You want to go to, I don't know, that's the one we use the most. What's another sleep study center? None are coming to my mind at the moment. But there's about 5 of them. And so if you want to use a different place, let them know at checkout before we call you and say you have an appointment, and then you say, oh, but I wanted to use the other place. That's fine. Just let us know, before we do all the work of sending you there. Like everything else in the world nowadays, there's lots of paperwork and lots of behind the scenes work in getting things to happen. And if all that work's been done and then we're going to change it, our medical secretaries don't love you. Okay. Now, I remember when I started at the clinic, this is my first time as an RN, and I've been in an outpatient clinic, and I've been an RN since 1976, and I think it was a real shock to me how much behind the scenes work is going on, because I always just went to the doctor and thought, man, they make a lot of money to spend an hour with me, and I thought that was it. I didn't realize that all these medical secretaries and schedulers and nurses and people behind the scenes are doing lots of things to make your visit happen and then to follow up on everything that was recommended at your visit. I mean, there's probably more work in the around the visit work than the visit time itself. That's just a small piece of the puzzle. So just be aware there's a lot going on behind the scenes. I always work places like ICU and psych units and school nursing, and where it was just pretty much what was happening there at the moment was what I saw. And I was just so shocked to see what was really behind everything. Now, again, if you didn't sign up for my chart on check-in, sign up on checkout. And they ask that you ask your driving directions when you're checking out, not when you're coming in, because there's usually a long line of people trying to check in. And also don't ask the MAs who are rooming you, because they've got to really keep a tight schedule to get everything done so that your provider visit can be on time. There's also a wall of upcoming events, classes, and resources at checkout, so make sure you look at that, and there's little handouts about the lunch and learns and the support groups and things like that. It's a great resource. While there talks about your provider, there's a card about each one with their picture, so if you want to know more about their education, things like that. Again, I said I would come back to my chart. My chart is the way to email us medically. We cannot send, by the way, a regular email. People often say, can you send me an email or can you send me an attachment by email? No, we can't. We have HIPAA restrictions on that, and the nursing staff can't send you a regular email. But through MyChart, we can send you all kinds of things. Not usually attachments, but we can, type in a lot of information for you. But remember, MyChart is for non-urgent concerns, and you should give us at least 2 to 3 business days for a response, all right? If it's more urgent, use our phone system, because then we will call you right away. Now, remember that our office hours are Monday through Friday, 8 to 5. And try not to call during the last hour of the day. I had to laugh because I had an appointment somewhere a week ago, and they said, oh, the last hour of the day is so crazy. Why does everybody call at 4:30? Because everyone is tired, our brains are tired, we're trying to get out too. And then all of a sudden, tons of phone calls start pouring in at once, and we're one person trying to answer everything all at once. And it's just not the most efficient use of everybody's time, and your response might be a little terser than it might have been if you'd called a little earlier in the day. And we want to give you our full attention, but we can't if 5 people are all calling at 4:45. Let's see. So try to call earlier in the day, and especially if you're worried on Friday in the morning that maybe you should call before the weekend, don't wait till 4 o'clock on Friday. Call us 10 in the morning on Friday. That's okay. And say you're just worried the weekend's coming up. All right. When you call, you should get a response back within 24 hours on a business day. So if you've called Thursday, or let's say you called Wednesday, and you still don't have a response Friday morning, I would call again, because our turnaround for phone calls is a lot quicker than on MyChart. We feel if you're emailing, typing in on MyChart, it's a little more time. Your concern is something we can get back to a little slower. But when we're working you in between seeing patients ourselves, we're assisting providers with different tasks, we're not going to be able to run to the MyCharts on a busy clinical day. We'll have to wait for a day that there's not so many patient visits. But we'll look at the phone calls, and if something seems more urgent, we try and get to that a little quicker. But if you don't hear a response from us, I would say call again. It means we didn't get the message. And sometimes that happens. People say, I've called you 3 times, and I'll say, this is the first time I've gotten the message. So don't be afraid to call back. Give us about 24 hours, and if you didn't hear something back, then just call again and say, we're wondering if you got my message. I put a summary of the phone tree. I would hang on to this, because while it does change from time to time, this really helps you navigate. When you call our 702-483-6000 number, the main number, it tells you what you're going to press which option for. And I know most people hate phone trees. I'm one of those people. I'm like, oh no, I'm going to be listening to all this, trying to decide what to press. It's just frustrating. But this will help simplify it. It tells you for appointments to change or schedule one, you're going to press 2. 1 you're probably never going to need. It's just if you need our address and fax number. You probably already have that on other things, right? Prescription refills, that you would press 3. If you need the doctor, the nurse practitioner, or one of the nurses who answers their calls, if you ask for a doctor or a nurse practitioner or physician's assistant, sorry, that's a mouthful, one of the RNs is going to be receiving that call. So press 4, and then it will get routed appropriately. Now, if you look down under the next box, if you pressed option 4, it's really important that you route it to the right provider. And it tells you that pressing 1 is brain health. That's the division where Claire and I work. And that would be Dr. Cummings, Dr. Bernick, Dr. Wint, Dr. Legere, Dr. Ritter, nurse practitioner Samantha McClay, PA Michelle Thompson, or nurse practitioner Maylene Ulep-Reed. So all of those providers, you would press 1 and then you press 4 and then 1. See how that works? You're going to press 4 for a provider, and then you're going to press 1 if it's a brain health provider. You're going to press 2 for movement disorders, Dr. Walsh, Dr. Blewett, or nurse practitioner Mary Gaucher. And again, who's going to answer that call? Probably Jeremiah or Regina, one of the movement disorder nurses. And you'd press 3 for multiple sclerosis for Dr. Hua, Dr. Hirsch, PA Susan Morgan, or Linda or Jerry Lynn are going to be answering that call for you. All right. Now, if you're pressing 5, that's a billing or insurance question. 6 is medical records. So if you need your medical records, that's who you call. All right? So if you want a copy of your chart or something, press 6. Press 7 again is research and clinical trial questions. 8 is if you're a medical provider, which I don't think any of you are, that's what you would press. You're a doctor calling here for a physician. All right? And press 9 just repeats that whole menu. But you have it there so you don't have to listen to it again if you hang on to this, okay? Now, on pressing 2, by the way, you might want to scribble in addition to appointments changing or scheduling them, you can use My Chart. There's a tab in My Chart to schedule your appointment, and you can press that as well. So ask on My Chart for a new appointment. All right. After the visit, remember, if you said, oh, I didn't want to go for my sleep study to, that place, I have a particular place I want to go, that's the time to call in and say, by the way, I really want to use this. Maybe they said, see an endocrinologist. This is the guy I want to go to. That's the time, call in. If you forgot to say it at checkout, you're going to let us know the next day. Now, if it's a non-brain health concern, you should be calling your PCP, your primary doctor. One of the problems the nursing staff has, people will call us with things that we have no control over. And if the patient is in another medical facility, I had a call this morning. A patient was in the hospital. They wanted me to call and tell the doctor something. I can't do that. That is a patient in their facility, and it's their responsibility what they're doing for the patient. We can make courtesy recommendations, but we can't tell another provider what to do. Does that make sense to everybody? I know lots of times the patients get concerned, confused, and they think we're gonna, one time they asked Dr. Ritter, would he stop by the hospital and see this patient? We don't do hospital visits, so a lot of those things we really can't help you with. But just stop and think, is the problem you're calling about a brain health problem? Is it related to the diagnosis of the patient, the diagnosis they got here? If it's not, then you should be calling your PCP for that. Again, keep a copy of the after visit summary in your binder and pick a spokesperson. There's nothing more frustrating than when the nurses are getting a call from every sibling asking the same question. So pick who's going to be the person who gets the information, and then that person can share it with all of you. It makes it a lot smoother for everyone. Again, with the referrals, I said the most common referrals you'll see are physical therapy, occupational therapy, sleep studies, MRIs, EEGs, and you're going to express those preferences at checkout. Within a few weeks of the appointment, you should receive a call. Sometimes 3 days later, somebody says, I'm supposed to have a sleep study and I haven't heard from anybody. It's probably still sitting on a stack of paperwork on some poor medical secretary's desk. And they go in order of how they receive the request for the referral. So if there's a lot of them, as I said, and everything nowadays, there's a lot of paperwork. And by the time they go through all that, it gives them several weeks, and then someone should be calling you. Also, unless we call you, don't expect results. If you went for an MRI or an EEG or an EKG, well, we don't send you for EKGs. Maybe you went for an OT evaluation. Don't expect the provider to call you to give you an over-the-phone result. At your next visit, they will go over the results of things. Okay, if we see something, let's say we do an MRI of your brain and there's some horrible tumor that we think could be cancer, they're not going to sit and wait on that until your next office visit. If they see an aneurysm or something, a blood vessel that's ready to burst, we're not going to say, well, when they come back in 6 months, we'll tell them about it. No. So if we do see something alarming or of concern, might be of lesser concern, but we'd still need you to know about it, then you will hear from us before the next appointment. But if you don't hear from us, just assume no news is good news till that next appointment. And if it's just something that's progressing slowly, not something really life-threatening, they're just going to wait till the next appointment to tell you where there's a slowly progressing problem. All right, now any of you that get referred to a place called Athena, I just put this in briefly. has to do if you're receiving a lumbar puncture, which is also spinal taps. You've probably heard that term. If you're going to be dealing with a lumbar puncture and the brain health doctor said that they want to do some more diagnostic tests through Athena. Athena is a lab in Pennsylvania, and they're the only ones pretty much in the country that do these tests, because some of the tests we use are not ordinary. You wouldn't go here in town to a Quest and they wouldn't do that test for you. All right, it's a very specialized testing because remember, we're on the cutting edge of brain health here. Dr. Leger explained one of the tests to me last week, saying, well, it shows the chemical changes that occur in the brain of an Alzheimer's patient when they have plaques and tangles. So if you've been reading about Alzheimer's, that's pretty much, they look for plaques and tangles in your MRI, and these chemical changes can also confirm that. The only reason I bring that up is if you get referred to Athena, please don't schedule your lumbar puncture without talking to a nurse first, because there's a lot more steps involved. And while Dr. Leger assures me that he explains that to every patient during the visit, if you're like me, when you're in the visit, half of what they say leaves you when you walk out. That's why you want that other person with you to be listening. Again, it's a little more complicated. Look at the after visit summary, but make sure you're talking with the nursing staff about that. And I don't mind. I know Brain Health does a lot of those. That would be Claire and I. You can always call us and ask a question. Also, insurance does not cover Athena, so don't waste your time sending that to your insurance. They do have an assistance program with pretty high financial limits, so unless you're like a millionaire, they're probably going to help you, okay? It's not like you have to be at poverty level to get help, all right? But again, we're sending blood and spinal fluid out of state, and I remind the patients that they're drawing 2 sets of blood and spinal fluid at these procedures, one for local testing of other tests and one for Athena. Okay, for imaging and PET scans, one of the things people ask me is why come here? We have better images with higher Tesla strengths. We're getting a brand new MRI by the end of October. They just took our previous one out, and it was already one of the best ones probably in Nevada. So the higher the number, the higher the Tesla strength, and it's going to give us a better picture of your brain. All right. Also, our radiologists that read the scans here, they're brain health specialists. All they look at is brain scans. They're not general radiologists that are looking at other parts of the body. So they're going to be the most accurate and the most focused on exactly what's happening, in your brain, because they look at brains all day long. Okay, and before imaging, I want to make sure the staff's aware of any surgeries, any kind of implants, including cataracts, lens, penile, any soft tissue implants, stents, pacemakers. And again, we talked about that product card. They're going to want it. So if you've already scanned it to your chart, yay. When you came to check in, it's there already and you're not scrambling around looking for it. Again, keep those original product cards in a safe place and make copies. If you're over 60, you're going to need lab tests before they do the scans if you're getting contrast. So just be aware that that has to be within 2 months of the procedure. So don't bring last year's labs. They're going to be asking you when and where were your labs. And after imaging, there's a special new form they have if you want a copy of the CD. Okay, that brings us to neuropsych testing. I'm going to speed up a little bit here in case some of our staff are here want to interject with things. But for neuropsych testing, and I know we had two of our neuropsychologists were here, but looked like they left already a minute ago. They said, just come with someone who knows you well, get a good night's sleep, eat breakfast, take your meds, and you can't practice for those tests, so don't be trying to practice. For physical therapy, again, make sure you're 15 minutes before your appointment. Our specialists here, why come here? All they do is brain health patients. We don't take physical therapy referrals for people for their tennis elbow or their hip replacement. We don't do that kind of physical therapy here, so they really are specialists in brain health disorders. Again, you're going to need to schedule appointments 3 weeks ahead. And they gave a direct number right here on the handout. You can call them. You can bypass the phone tree and call them directly to reschedule or cancel. Please give a 24-hour notice if you know you're not making your appointment at minimum, because there's a wait list of people just trying to get in. And it's sad to lose those appointments that could have been used. And bring your home exercise folder to every appointment. And they said make sure you're following the recommendations at home. They put you on a program. You're supposed to do all those things while you're at home. For OT, the same thing. Bring your binder, they told me. Think about your specific goals and what things in your daily activities you'd like to improve, and bring your list with you. When it comes to medications, again, allow us 3 to 7 days for refills. Don't wait till, oh my goodness, it's the last pill in the bottle and now it's Friday afternoon at 4 and I'm in crisis because I don't have any medication for the weekend, right? So please think ahead. You know, you only have a few days left in that bottle. Maybe a week's worth is about the time you want to put in the request for the refill. We talked about having your prescription insurance card copied when you're checking in or checking out. And give us 7 to 10 business days for prior authorizations. Very often we're appealing those, and I'm going to tell you right now, we have Dee Dee and Patty here. They're two of the girls who do, they're our medical assistants who do prior authorizations and appeals. They have like a winning record. They come dancing in the office, they'll say, I appealed 3 times, and now they can get that medication, and we all applaud and we're so excited. So sometimes the insurance does, you know, they want to make it really difficult, and these are the poor ladies who are trying to make it happen for you. But give them time and realize if they appeal, they're not going to have an answer in a day. It's going to take up to 4 weeks just for the answer, and then they may appeal it again. If they hear it's denied 2 weeks later, they appeal again. They keep appealing until they get a yes. They're very persistent. Okay? They do everything possible. Now, when you're asking for any kind of form, letter, or paperwork, if it's something like placement in long-term care, adult daycare, assisted living, give us 7 to 10 business days. Don't show up in the lobby and say, I need this form filled out for tomorrow or for today. Because if we're with patients, we can't say, oh, sorry that you're in an appointment. I have to leave now and go fill out this paperwork for the person in the lobby. We can't do that. Think how you would feel if someone left your appointment to go fill out paperwork. So give us time to work that in around the appointments, and that includes jury duty, driving, requests, imaging requests, remember, go on a special form. And also, if there's a section that talks about how's this person eating and their nutrition and their toileting, we are not addressing that here, are we, at your brain health visit? So the primary doctor, the PCP, should be filling that section out. We're happy to address the brain health section with the brain health meds and diagnoses, but you probably need 2 copies, one for the brain health doc and one for your PCP on lots of that paperwork. And I said, allow us at least 1 week of business days. Some of the departments have said they need even longer. Thanks for coming, ladies. I gotta run back to the patients. Okay. Again, we do have Quest and LabCorp services here with the hours I put down for when they are collecting laboratory samples. If you'd like your labs drawn here, we're supposed to be expanding those soon. And lastly, I'll touch on other services. I listed the support groups that we offer here at the center. And for your first visit, you really should email or call the numbers that are listed to say that you're coming to the support group. And they can tell you a little more about the group. But we have frontotemporal disorders, Huntington's disease, memory loss for caregivers, and Parkinson's disease care groups. So there's support groups. If you've never been in a support group, I personally can say that being in a support group was one of the best things I ever did in my life when I was a cancer patient. There's nothing like being another patient and talking to people that are going through what you're going through. They have a totally different wavelength than your provider. Okay, your provider's looking at you very clinically and scientifically. Your caregiver, your support person, they're looking at you for how is this affecting your daily life, because they're living it too. And I was really sad when my support group disbanded. It broke my life and my heart. I went there for years, long after I needed to. It was a great place, you know, and helped the new people. And you just can learn so much by going to a support group. So if you haven't tried one, I'd recommend it. Now, social workers, don't be afraid to call for assistance. One of our social workers, Samuel Hickson's right there on the side. Thank you for coming, Samuel. He said he'd answer your questions too in a minute. And he has a patient and family social services brochure that I believe Jasmine brought some or was going to, if you'd like that. And Samuel told me that he can educate about what to expect with the disease process if you have questions about what should I be expecting for my loved one or for myself. He can also make referrals to lawyers, transportation, respite care, long-term care, assisted living, and more, okay? We do provide counseling for depression, grief, anxiety, panic attacks, both individual and family counseling, but he does not do any bipolar or schizophrenic counseling. So if you have some other psychiatric disorder, he's probably not going to be able to give you counseling, but he can refer you to someone that could. And then we also talked about the library. The location is next to the check-in desk, and you can change that 10 to 2 is now 8:30 to 4:30. Wonderful. We have a new full-time person in the library. The cards are free. I think the caregiver resources in there are fabulous. Every minute I'm not doing something else on my list, I'm buried in a book reading about different types of dementia and strategies for dealing with patients who are presenting challenges to you so that I can help the caregivers. There are so many good resources that you'll say, wow, I never thought of that, and that's a great tip, right? There's also an email address and a direct phone number if you want to call and get the card number if you don't want to actually go into the library. And we also have a benefit in there that Jasmine brought some of it. It's one of the resources Samuel shared with me earlier in the year. It was Harry Reid's Retiree Benefits and Assistant Resource Guide. I actually love that resource guide and live in it. Any senior you know will love it. It's hundreds of pages thick, and it talks about everything from transportation resources if you're not driving anymore, to understanding Medicare, to where our support groups all over the state. It's a great little resource, and we have some copies for you in the library. Samuel did caution that they do update it from time to time, so sometimes you might call a number and it's no longer in service, but that's probably like 5% of what's in there, you know, does change. But most of the stuff is still there for you, and at least it's a lead on where to call, where to go. It's a great resource. Thank you so much for coming. I hope you learned something and it was beneficial to you. Thank you.